The G-spot is a sensitive region on the anterior vaginal wall, typically a few centimeters from the vaginal opening. The G-spot region's sensitivity can vary greatly among individuals due to differences in nerve distribution and tissue composition. During arousal, this area may become slightly swollen or feel different in texture. The clitoris is a complex erectile structure with external and internal components, rich in nerve endings. The external portion, known as the glans clitoris, is only the tip of this extensive organ. The dorsal nerve of the clitoris, a branch of the pudendal nerve, provides sensory innervation. This intricate neurovascular complex allows for the high sensitivity and erectile capabilities of the clitoral tissue. G-spot augmentation involves the injection of a biocompatible filler into the anterior vaginal wall. The syringe is carefully inserted through the vaginal opening, targeting the anterior vaginal wall. The filler is gently injected into the G-spot area, creating a subtle bulge in the region. This increased volume is designed to enhance sensitivity and potentially make the G-spot easier to stimulate. Clitoral augmentation enhances sensitivity and prominence of this complex structure. Careful injection of filler along the clitoral shaft or around the glans requires precise needle placement to avoid nerve injury. A minor clitoral hood reduction may be performed, though this step is optional. Post-procedure, mild swelling may occur. The goal is enhanced size and sensitivity without compromising function. Results can last several months, depending on filler type and absorption rate. Proper aftercare ensures optimal healing and results. Potential risks include infection, temporary discomfort, oversensitivity, and rare cases of filler migration. Monitoring for unusual symptoms is crucial.